Another study that I think is super important and we need to focus in finding patients to participate is this randomized phase 2 trial looking into Lu-177 or Lutatera versus Everolimus for patients with neuroendocrine tumors of the lung that are positive tumors somatostatin receptor imaging, such as the DOTATATE PET-CTs that I mentioned. And this is important because I touched on this before. The FDA label approval is only for GI origin neuroendocrine tumors or unknown origin that you feel is GI. And there is no FDA label approval for the use in LACNETS. So some patients that have LACNETS might find challenging to receive the treatment because the insurances might decline approval and say there's no data. So this is a trial that is going to help us to answer that question. Is PRRT with Lu-177 a good option for patients with LACNETS? This is a study that has been developed by Dr. Tom Hope and colleagues from UCSF and is supported by Alliances. Again, is an NCI-sponsored trial. Kudos again to the NCI. And patients that have positive somatostatin receptor tumors in the imaging with the DOTATATE scan and had progression of disease in the last 12 months can be randomized to PRRT versus Everolimus if they have not received Everolimus in the past. If they had already received Everolimus, then they are not eligible for this study. And patients that, in the flip of the coin, I say that's the randomization, they were randomized to Everolimus at the time that we see progression, assuming that they continue to do well in terms of their performance status, blood counts, and so forth, they will be given the opportunity to switch to receive Lutatera. This is a treatment in which the Lutatera or lutetium is actually sponsored by the NCI, so insurances are not charged by that. And the goal of the study is to see improvement in progression-free survival, or meaning how long it takes for the tumors to start grow again, and for us to see new lesions.